All right, welcome everybody to the September 2025 CHWs in Research CHW Circle. We just had introductions. We have a really amazing breadth of CHW experience. We have some folks, I think one person had just started as a CHW 2 weeks ago, and someone else mentioned they had been a CHW for 15 years. So I'm really excited to have a high level of expertise today. Today really is truly peer learning. So I'm going to have a little bit of a slideshow, but there's a lot of interactive pieces of it. So if folks have your phones available, go ahead and scan that QR code in the bottom right-hand corner with your phones. And there will be some activities in Mentimeter where we can participate. And folks are also welcome to come off mute and speak, but we can use the Mentimeter as well. All right, I'll stick this QR code up so you guys can continue to do that. So the first thing I just want to start out by defining this one term, and that's all we're going to do. But what is research? So we're talking about CHWs in research, and very simply, research is answering questions. So the first step is identifying a problem, learn what's already been studied, ask a question, answer the question, collect and analyze information and data, and then report that out. That is like the very basic function of what we mean when we say research. I am not a researcher. I have an undergraduate degree and a CHW certificate, and neither of those things emphasize research. So I am not an expert in research, but I am a CHW, and I'm really passionate about the ways that CHWs can engage in research going forward. And that's what we're kind of here to talk about is what can we do as a workforce? So the first thing we're going to do, this is going to be a word cloud. So get out your phones, scan that QR code, and then just write 1 or 2 words. What comes to mind when you hear the word research?
Where is the QR code?
It's on. Can you see my screen? Or did it go away?
Okay. Oh, okay. I see it.
So it's the bottom right-hand corners. There's a QR code. Is that working for other folks? Good job. Okay, so we've got science, analyze, learning, data collection, collecting database, knowledge, science, looking into something deeper, expanding what I know. Data is taking up a big spot. So one thing that I want to point out that I think CHWs, it looks like we're sort of seeing as research in these words as something that's outside of a lot of what the work we're doing. And so I think what I'm hoping to today is to explore how research already exists in the work we're doing and how it kind of can exist in the work that we do as CHWs. I love its lengthy process, expanding what I know, knowledge, engagement, accuracy. Thank you. Okay, so then this next part is a little bit of a quiz. So the question is, I'll put the QR code back up in case folks haven't got it yet. Question is participating in evaluation and research part of the CHW scope of practice? So we've got a few answers. The first one is yes, both the C3 core roles, which is the Nassner standard, and the Minnesota scope of practice. Yes, only Minnesota. Yes, only national C3. No, but it should be, and no, and I don't care if it is. So go ahead and I'm going to get my QR code up too. I want to hit participate. Okay, we got a few more people to participate. Looks like a lot of people are saying yes to both. It looks like we've got a few more. Anybody else want to vote? Sometimes it gets to where everyone chooses the most popular one. Okay, I'm going to reveal the answer. Wrong, everybody. I'm the only one who got it right. So in the C3 core roles of community health workers, participating in evaluation and research is specifically called out. And in the Minnesota scope of practice, it is not specifically mentioned. I'm bringing this up because I want to explain why that is, and talk a little bit about it. In the Minnesota scope of practice was written around the same time as the Minnesota curriculum, which was in the early 2000s. And the C3 roles were created a little bit later. And so when the C3 core roles and competencies came out, Minnesota looked at it and said, should we adjust it? We saw that, I'm saying we, I wasn't around then. I just became a CHW about 5 years ago. But those who were around saw that they matched up almost perfectly, but it was missing that research and evaluation piece. So that is why there is not, those of you who are in the CHW certificate program in Minnesota right now, there isn't like a whole class or section on research and evaluation. It might be touched on as you talk about other things, but it's not emphasized in our curriculum. So that's, I'm not putting a value judgment on that. I just want to let Minnesota CHWs know why that is, why it's not in our scope of practice. And also to say that we can, you know, as a collective, as CHWs, we can talk about changing that. We could talk about adding it to our scope of practice. We can talk about including it in our core curriculum, or we could talk about ways that we can get that information and get that become competent or use that core competency through other means. So I'm glad I did the quiz. That was fun. This next question is open-ended. So if you use your phone, you can type in the answer. And the question is, what experience have you had working in CHW, working in research as a CHW? I see a none. I was expecting some nuns. None. Verifying resources, data collection, focus group. Looking up resources to share with patients. Good. HEDA assessment? I don't know how to say that word. HEDA. Data collection. So we've got a lot of data collection, some focus groups. This is great. I think a lot of times we are doing some parts of research and evaluation without knowing we're doing it. So I was a part of, when I was a community health worker in the field, I was a part of a evidence-based model, and we collected a lot of data, and that data was then used to create annual reports and even sort of advocate for changes in my community. But when I was a CHW, I didn't really know that. I was just kind of filling out the forms they told me to fill out. And I think a lot of times CHWs are participating in some evaluation and research of their own programs or at a wider scale without really knowing that that's what we're doing. So I think one of the first steps towards understanding that research is a space we can be in is to understand that we are already participating in research in some ways. So here's the next question. What roles do you guys think CHWs can play in research? And this can be research, you can think of big or as small as you want. So it could be research and evaluation of your own CHW program. It could be research and evaluation that's done by a large entity about a community that you are a part of or that you work with. It could be national. Is there a role for community health workers in Minnesota to talk about the community health worker profession on a national level? Are there things we can, how we can participate in that? I love investigation. It's a great one. Data collection, documentation of the work, informing methods. I love informing methods. Does the person who wrote informing methods want to come on and say a little bit more? If not, I will make some assumptions and say what I think about informing methods.
Informing methods is me. Shocker.
Thanks, Chelsea.
Yeah, no. So as a researcher myself, I'm not always in the community in the same extent, to the same extent that CHWs are. And so particularly as as I'm doing my methods, I always want to make sure that I am being true, I am being real, and I'm making sure that I am doing right by whatever community it is that I am conducting the research with. And so that's really where I hope that we can move as a CHW field and get CHWs involved with. And also when you inform methods, or having CHWs helping inform methods, and make sure that all the data comes back to the community that it should, and it's just a much more holistic, comprehensive process. So, yes.
Wonderful, thank you. I don't know how I accidentally started clicking on just one. There we go. Yeah, so I think that's really important. I think one thing that I think of is that a lot of what drives research is questions. And I think CHWs are often brought into research later. Like you said, Chelsea, great idea. We always want CHWs to inform methods because we have good insights into our community. But CHWs can also be the ones who might ask the most interesting questions about what's going on in a community we are part of or that we serve. So yeah, interpreting the challenges about any given community, providing resources and informing. These are great. Data collections in the deaf-blind community, absolutely. Psychoeducation. And so I think we're making an assumption with a lot of these that we're talking about research that CHWs are going to assist with that is about a community that we're either a part of or that we serve. But we can also talk about CHWs researching ourselves. And so thinking about what kind of research can CHWs lead. So sometimes we think about like, how can we assist a researcher? But I'm curious if you guys have ideas about where CHWs could lead the drive, right? Like we could be the ones that are asking the questions. We could be the ones that are creating the hypothesis, creating the structure, workshops, data collection. Data collection is huge because you can't collect accurate data if you don't have trust. We all know that as CHWs in the field. And so you need trust. Often you need trusted messengers to get good data. Developing ASL videos for questions or information. Love it. Provide resources. Yep. Case management, sexual health education, advocacy for less known topics. CHWs are so good. One of the things that I've noticed in just being in the CHW field for about 5 years is that CHWs don't like to take no for an answer. We like to push until we figure out what's going on. And that's something I admire about CHWs. And so CHWs have this tenacity and we are really driven. So I think we can really be good researchers because we get to the bottom of things. Ooh, somebody found the thumbs up. You guys, there are thumbs up things at the bottom of your phone. You can click if you want to make the thumbs ups fly whenever someone says something you like, or if there's a one that pops up you like. Thank you. Okay, so then here's this is my last one like this. I know these are getting kind of boring, but what research questions do you want answered about the CHW profession? Like if you could ask any question with a magic wand and you would all of a sudden know about the CHW profession in Minnesota, in the country, in the world, what question do you want answered about your profession, your workforce? So one thing that comes to my mind is, how much do other CHWs make? How much am I making the same? Yep, wages. Am I making the same amount of money as someone in a different county? Am I making the same amount of money as someone at a different organization? So wage information. Where are all the resources in rural Minnesota? Documentation, clarify gray areas between social workers and CHWs. Yes. So for clarifying gray areas, I think one of those questions is, what jobs are CHWs doing in Minnesota? Like, what are we already doing? Is that within our scope of practice? How can we as deaf CHW can serve our deafblind community in healthcare when we can't seem to be able to? Yes. One other thing I think of is paths for advancement. Like, are there CHWs? When I was in a CHW job, I felt like I didn't have anywhere to go or grow in that job. So are there other CHWs at other organizations that are able to like become supervisors or become managers or sort of grow their career? What possibilities of growth are in this profession? Yep. Duties in different public health departments. This is great. Grow my career. Yes. So career development. So when we talk about career development, we mean, do you have a place to grow, right? Like, can you become a supervisor of the CHW program? What can we not do? How to get people to answer their phones. That's really funny. Especially people at the county, whatever county you're in, I'm sure. How to spread information to the younger community. Awesome. All right, so now I'm just going to talk to you a little bit about what we're working on at the Alliance, and I'll give Chelsea a chance to talk a little bit about what Search is working on too, but I'm going to talk about mostly I'm going to talk about the statewide CHW measurement plan, and I'll just touch on right now the CHW conference. So first of all, conferences are a great place for professionals to get together, compare notes, network, and just really find out from one another what's going on. There is going to be a conference, a rural CHW conference in Bemidji in November. There's information about that on our website. And we just closed the opportunities to present, but if folks are interested in doing a poster presentation, we actually still have space for poster presentation. So if any of you guys as CHWs want to do a poster presentation, that would be welcome. And then we are planning on having a spring conference as well, and that'll probably be closer to the metro. So there's going to be some opportunities for in-person ways of learning and evaluating our own selves. And then we also have a statewide CHW measurement plan. We developed this plan this summer, and we are working on implementing it. And the very first thing we are doing in the measurement plan is a CHW survey, asking all these questions. There's going to be an employer survey next month, and we have huge opportunities for CHWs to participate. So if any of you guys are interested in being a part of learning about how to do research and evaluation of the CHW profession with us, no experience necessary. We're looking for CHWs to be part of that project with us. And then this is an opportunity for anyone to type in about what else is happening in the world of CHW research. I know Chelsea has one. If anybody else has anything else going on in the world of CHW research, either type it in the Mentimeter or go ahead and come off mute. And Chelsea, if you're able to come off, go ahead and tell us what's going on with search.
Yeah, absolutely. I think I'm able to be off mute for a moment, hopefully. Yeah, so full disclosure, I am onboarding with Search tomorrow. I would love I would love to maybe I can report back to you, Rachel, and give you a little bit more something, like if you're sending out the slides, I can add a little addendum or something like that. But I do know for a fact that Search is really looking at how to get CHWs involved in more research, and potentially looking at what that looks like from a as you said, potentially getting creating a module that CHWs can take so they feel comfortable engaging in research, and also potentially creating some repositories. So who are CHWs that are interested in being involved in research? And then on the opposite side as well, researchers like here, and I'm using my hands a lot, so I'll come on camera here for a moment. Researchers like myself, potentially at the U, making sure that, providing resources to us of how to appropriately engage CHWs. And okay, hold on. Sorry. So that we make sure that it is equitable, and it is when we work with CHWs, we know how to work with them correctly, especially if I'm thinking about a big PhD kind of a person. I make fun of myself, but if I get the elbow patch kind of dude, but helping CHWs be comfortable in that space, and then making sure that the big academic people know how to reach out, and making sure that CHWs are involved from stage one, as you also had mentioned, Rachel, bringing them in, for developing the research question. Are we asking the right question? And are we creating the methods? Because as I've said, and you've said it, Rachel, and everyone else has said, CHWs know your communities. We as researchers might know some of the data and some of the what's been done, but we don't know the community the way CHWs do. So really trying to bring both sides together to create meaningful change. So that's my long-winded of what I understand where search is really looking to go. So I'd love to be able to, hopefully maybe next week, once I get a little bit more into some of my role and what I'm going to be doing, be able to provide some more. But I hope that's helpful.
Yeah, that's perfect. And I think that's something that they're basically working on a training module that CHWs can take that's a research 101, and they're doing that with CHWs. So that's something that we will have on our newsletter coming out later. But I just wanted to give any other opportunities. We see there's focus groups happening. There's more data needed, and there are new health crises like measles that we definitely need to stay on top of. So I just want to talk a little bit about the statewide measurement plan. This is because I really want to plug this, and like I said, we really need more CHWs involved. So what we want to do is we want to measure the workforce of CHWs over time, and we want to measure the impact of CHWs over time, and we want to do this so that we can become as sustainable as possible as a workforce. We know that there's really uncertain times right now in terms of funding and a lot of other things. And we want to really be able to illustrate that community health workers are more needed than ever during these unprecedented funding times. So during the Medicaid cuts, during the SNAP cuts, all of these things that are going to deeply affect our communities and affect our employers, we want to show that CHWs are the solution to these many issues that we face. So we want to define and standardize the metrics for CHW evaluation and establish baseline data. We've already started with that. And then we want to make sure that CHWs, especially employers, state agencies, funders, everybody else, are involved. And we want to focus on measuring CHWs collectively. So measuring us all together and having those performance outputs. And we designed a lot of it with the CHW Common Indicators Project, which is a national project, which I'll talk about in a little bit more. But we're going to be measuring, like I said, workforce conditions, living wage, benefits, advancement opportunities. So that's exactly what all of us on this call were really concerned about. Our impact outcomes, how we're impacting our communities in positive ways. Policy and system change indicators. So what's happening at our employer level and at the state level that's either supporting us or not supporting us. And we want to get that information from a lot of different data sources. But the first one is going to be the CHW survey that we just launched. So the statewide CHW survey is based on the common indicators from CHW CRE. And we really want to elevate CHW voice and expertise. We want to standardize data across lots of different programs. We want to demonstrate CHW impact, and we want to inform policy for workforce development. So we want to create structural change that will make it easier for CHWs to do the work that we know we're really good at. And before we do that, we need to know what's happening now. So we've got this survey. So I want to just, before we do this last Mentimeter, I want to touch on each of these things. So the statewide CHW survey is online now. I'm going to put it in the chat. I would really love it if all of you would be able to complete that survey and to encourage your friends to complete it so that we can get this baseline data. We will have an employer survey that is similar but not exactly the same that we want you to tell your employer about. We would love it if any, people are already, oh my gosh, all fives, whoa. We would love it if people are interested in joining the data and evaluation work group so we can implement that measurement plan with the voices of CHWs. we want you to think about considering the way you can participate in evaluation and research at your job. And when that CHW 101 Introduction to Resource module is available, we'd love it if you completed that as well. So if folks want to go ahead and tell us where you're at with these things, we can see where folks are interested. And then we're going to take off the share screen. Okay, so Jordan wants to know how CHWs will be notified. That's a great question. I'm going to send out a survey for this CHW circle. And in that survey, there's going to be an opportunity to give me your email address or to email me to get on that work group. And then we'll get a list that way. Oh my gosh, we got all 5s. This is exciting. I was not expecting all 5s, guys. There's got to be somebody who doesn't want to do the data and evaluation work group. I love it. Oh, thank you. Yeah, data evaluation work group. We got a couple people being honest. It's a maybe. I know you guys are all really busy. All right. It seems like from these answers, people are feeling kind of activated and excited. So you guys can continue to contribute to the Mentimeter. It's going to be up for you on your phone. You can continue to add those questions, but I'm going to go ahead and stop sharing, and we're going to continue to just have a conversation, and I'll stick some stuff in the chat. So what was surprising about that stuff? Did you guys feel like there were things about research that you weren't aware of before? Does anybody want to speak a little bit about their experience learning about this and what they want to learn more about?
I would like to learn more about looking to help stabilize all of our careers in this, because I think that is very important. And I think community health workers are often people that kind of get overlooked, during everything that goes on with helping the young adults in America and even the elderly, and just help educating the community. I think that sometimes community health workers just kind of fall in between, and they're not able to get that recognition. So if we could raise that awareness, that would be great.
Yeah. Who has felt worried about their own job security since January? Show of hands. I have. I mean, yep, thank you, Angel, Kathy. I mean, it's been really particularly scary, but I think that CHWs, like I said, we bring so much value, and frankly, we save people a lot of money. And we do so much for our communities. So we really are just so vital, and all we have to do is show everybody, right? And so this is us. This summer, when we created this measurement plan and the sustainability plan, the purpose of it is to create a structure and to put some resources behind showing everyone how important we are, so that we all can continue doing the amazing work we're doing with our communities. Because I would bet that most of you on this call, if you lost your job tomorrow, you would keep doing the work you're doing for your communities. It would just look a little bit different. Does that sound true? So
Yeah.
yeah, we're all here because we've been doing this work our whole lives. And then we discovered that it was called being a community health worker. And we discovered someone would pay us for it. And we were like, whoa. Go ahead.
I just wanted to, is there a way that we can get like more providers, or, like the clinic where I'm at is just like, nobody really knows what we do. And I'm like, I'm gonna start having brochures of like, here's all the services I can I can provide for you. But a lot of them, they don't know. They're like, oh, what does she even do anyway? Or like, because I'm all over, I'm doing outreach, I'm doing this with some patients, or just different things all the time, and they're just like, what can you do? And I don't know, it's hard to have to explain to everybody and then where they need to utilize me in the clinic and things like that.
Yeah, so one of the things we at the Alliance are working on is to create stuff so you don't have to make that every time, right? There are specific things like that are within the CHW scope of practice, which are in those C3 core competencies. Like, it is a profession, it has definitions, and I think everyone who's ever been the first CHW at their organization has had that experience. I certainly did. And in my experience, it was like, we don't know what you do, so we're going to give you the hardest cases. We're going to give you the folks that no one else knows how to deal with. We don't have time in our 15 minutes. And so sometimes it can turn into CHWs being really under supported and overtaxed, or it can be the opposite, where nobody knows what to do, so they don't give you any work, right? And all of us are doing this because we want to do the right amount of work. We want to be working right at that edge where we're feeling stretched but not pushed, right? So I'm hearing that coming up with things that you can bring to your employer and say, here, this is a pamphlet about what CHWs are, so you don't have to be sitting there on Canva making it yourself.
Yeah, and then like a lot of times they have their BHCs there. They're behavioral health consultants, and a lot of them they're not familiar with like substance use and things like that. And with my addiction counseling background, they tend to grab me a lot for that. And I'm like, okay. I mean, I'll do it, but I'm just like, I don't know if that's like appropriate or not.
Yeah. Yeah, I think making sure you're working within your scope and that everyone knows what hat you're wearing, that can happen a lot of times with interpreters too. If folks are interpreters and CHWs, people think they can do both those things at the same time, but in reality, you can't interpret at the same time as you're doing CHW work, because they're different jobs and you can't do two things at once, and they are in conflict sometimes, right? So a lot of CHWs have a lot of stackable skills and life experience and credentials and language experience and all sorts of things that makes it really easy for you to be pushed. And it's really difficult for an individual CHW to tell like a doctor, like, oh, I'm not going to do that. That's not my job, because that's really uncomfortable, right? So having an organization like ours continuously reinforce, like, this is the appropriate scope, so that you don't have to do that at your job where it's uncomfortable.
But in the scope of our practice, it does say peer support. So that kind of fits in that area. I don't know.
Yeah, on some things we have to define it within a specific workplace, right? Like, what's the role within a specific workplace, and not every workplace may have every single role of a CHW. So there is going to be some lines there. What else are people thinking about? I did put the statewide CHW survey in the chat, so if folks want to start scrolling through it, it's a little bit long, and we really want folks to be as honest as possible. This will never, I was thinking, we had the zip code on there, and in my zip code, there's only one CHW program I could work for in the zip code I'm in, because I live rurally. And so, even if it's possible that someone could identify you with this information, I want to just assure you that we won't. We are going to put all this information together and sort of package it as an analysis. But it really speaks to some of these like questions. There's a whole slew of like, if you strongly agree, strongly disagree, all that stuff, and they can kind of get overwhelming. But I think there are a lot of questions that CHWs really love to answer. So things like as a part of my job, I am a member of one or more groups or organizations that make policy for my community, city, county, state, or tribe. So like, does your employer allow you to, like, on your paid time, go to a meeting? Like, for example, when I was a CHW, I was a part of the Criminal Justice Coordinating Council for my county. And I was part of the Early Intervention and Prevention Committee of the CJCC. And so that was an example of, on my paid time, I was able to go to a community meeting that had sort of policy impact. And not all CHWs are allowed to do that on paid time. So that's kind of like, we're really asking, like, are you in your job, are you given the structure you need to do your job really well and to be a full community health worker and to be your whole self? So don't get overwhelmed with all of the questions. I would like to try to space them out a little bit better. We had a snafu on this form where I thought it wasn't going to even work today. So it's kind of ugly, but we're working with it. But we really want to know, like, that integration with healthcare teams. Like, how much do the other healthcare, social service, and or education providers with whom you work know about the work you do and about your program's participants? Like, is there any kind of intersection between the work you do and the other professionals at the same organization? So does anybody scrolling through this have any kind of questions about specifics, or is anything popping out to them as you're looking at this statewide survey?
I have a question.
Yeah.
Because you said to share it. For this survey, is it only if they have the certificate, or can they also take it if they don't?
They can take it if they don't. So the first question, it sort of teases that out. So the first question is check all that apply. So I currently work as a CHW in Minnesota. My title includes community health worker, or I currently work as a CHW in Minnesota. My title does not include community health worker. I work outside Minnesota. I have a certificate. I don't have a certificate. I have an NPI. So anyone who considers themselves a CHW and can check any of those boxes on the first question is welcome to participate. We know that the certificate, a lot of people have gotten the certificate in the past few years, which is really exciting, but there are still CHWs working out there who don't have the CHW certificate, and we want to capture everything, because that's one of the questions we want to ask, is sort of that balance of people working with a certificate, people who don't have a certificate. Yeah.
I have a question.
Yeah.
So I never heard, see, this is why I'm here today, because I never heard of us having an NPI. That's the providers, doctors. Now, what's UMPI?
Yeah, so this is a little bit in the weeds, and I just was told to add this by the UMPI by MDH. So when you graduate with a CHW certificate, you can apply for an NPI number, which is the National Provider Identifier
Right,
number.
that's
Is that right?
exactly
Okay.
what it stands for, yes.
Yes, so if you don't apply for an NPI on the national database and your employer wants to bill with you as a CHW, if you register, maybe it's not register, if you enroll with DHS as a provider and you do not yet have an NPI number, they will assign you an UMPI number, a UMPI number, as you enroll with DHS to bill, and as your employer enrolls with DHS. So go ahead.
Sorry, can I still do that at this point? I mean, I graduated in 2014.
Yeah.
And I always have worked, I mean, I work in insurances and mental health clinics, and now the clinic I'm working, we work under funds that are donations. Basically, we don't charge to insurance or anything.
Yeah.
So that kind of holds me back. And like I said, this is the first time I realized that we could have a number, which I would like to have a number just in case I decide. I mean, things are very crazy right now, just in case I need to go someplace else.
Yeah. So I believe you can. I have a info sheet about how to get your NPI number, and I'll put my email in the chat right now. And if you email me, I can send you that. I will say that, so CHWs get our own NPI number, but we still have to bill under an eligible provider. So if you're billing, you still have to bill under a doctor, but you do need your own NPI number to bill for CHW services.
Okay, well, great. Thank you so much. I mean, I guess I needed to be here today.
And it's possible, I mean, do you think you could have possibly applied for an NPI number right when you got your certificate and don't remember? Because you can look yourself up.
Because I remember I registered something. I went and the Ramsey website and did something, but I don't remember. But I would want to make sure that this is actually accurate.
Yeah, so and you can look up anyone who has and you should know this, anybody who's getting your NPI number, the information you put in gets put on a national database that is free for everyone to see. So I just put that NPI registry in there. If you put your first name, your last name, and then they even let you, I can show you actually. I thought this was pretty interesting. I'll try to find myself.
Okay.
So you put your first name, last name, and then I think we'll do Winona.
Yes.
Individual. Oh yeah, so you've got to put the community health worker in the taxonomy.
Okay.
It's telling me it says large search, but I've got my name here. So maybe I need to take this out. I remember, there we go. So here I am. It's a little bit futzy, like I just showed you with the searching.
Okay.
Sometimes you have to take out your city state, but here's me.
Okay.
This is the address of where I was employed and the phone number. If I click on my NPI number, you'll see that I put my mailing address and my primary address as the same as my employer address. So, you know, I would recommend don't put your home address on here if you don't want it on all the internet.
Right.
But this is one of the ways that this is one of the data sources we do have for CHWs in the state of Minnesota is like who has an NPI number. But you can look yourself up.
Okay, perfect. Thank you so much.
Yeah. Great. Okay, I see a few people are hopping off. It's about 4 o'clock now. What I will do is we've got a survey that I'm gonna put in the chat as well, just for like how this experience of this session was for you. And I would just love it if everyone is able to complete our surveys. So one is the sort of survey is like, how is the September CHW circle? The other one is that CHW, statewide CHW survey. I would love it if folks are able to complete those and then promote them with your colleagues. We will be sending out an email blast in the next week that has that CHW survey information for everybody to complete it. And then I will send out this recording with both survey links in an email as well tomorrow. And folks are welcome to hop off if you've got other stuff going at 4, but I can stay on as long as people are interested to continue to have these conversations.
I need to hop off, Rachel. My son just told me he has to go potty. But I just want to say thank you so much, and thank you everyone for letting me join. I really appreciate learning from all of you as well. And I also want to just say, however I can support, especially in this role in search, I'm really interested. And I actually really also appreciated the conversation around job security. There's actually another project that I'm beginning to undertake, specifically looking at CHW job security and then potentially looking at some sort of employer intervention. So anyways, all that to say.
Chelsea, I have a quick question.
Yeah, please.
It seems like maybe you're on the data side or research side, but do you work remotely, like hybrid from home, or are you in the office some days?
Yes. Today I'm in the office. So I'm hybrid. Some days I'm at home, some days I'm in the office. Yeah.
Okay.
Great. Well, thank you, Chelsea.
Okay.
Yeah, I think.
Thank you.
Okay. Yeah. Thank you. All right.
Bye, guys. Yeah, I think a lot of CHW jobs are fully on site, and research might be a space for CHWs who want to be hybrid or want to be fully remote and work in more of a statewide or national setting. Like getting these skills on a local level and then continuing to advance your career in research can kind of lead to those job opportunities that are less less hands-on, less on site, less like home visiting, and more kind of in in a different space. Is that what you were thinking?
No, I just me personally, I've been working hybrid. It was completely hybrid for 2 years. And then the second one is I was working from home Monday, Wednesday, Friday, and then the office Tuesdays and Thursdays. So that's my current role. But like I said, I've been working in housing stabilization for the past 10 years. So I got excited to see that um, people who are unhoused and facing homelessness or just needing help with financial literacy, it has trickled over into community health work because of the health need for stable housing and it being a basic human right and how it can disrupt the medical system if someone is on the street and not getting the proper care. Just so many different things with housing and medical. But my first position hybrid was at a literacy center. So I think there's so many opportunities. I get maybe I'm lucky. I don't know. I haven't had a lot of problems professionally at all. I already took the survey and it just helped me realize that I've been supported in my positions. I haven't had too much pushback on, even with my current job, they changed the title of the position to match what I actually do more. So, yeah.
Yeah, and that's what we want. We want to get those best practices from those employers who are treating people really well, and we want to help all the employers see that CHWs really thrive when we have the support we need, and it's really tricky to do our work if we aren't supported. So that's cool. I'm excited to hear that reading the survey made you realize, like, oh, things are okay where I'm at. I am supported by my supervisor. I do have my team knows what I'm doing and respects me. Those are really important pieces.
Yeah, I actually became a community health worker while in the role, and I did my internship there too.
Awesome. Awesome.
But with parents, it seems like Chelsea was a parent. I think sometimes in what community health workers could work on is to more careers for parents to allow parents to be with their kids more. And it's not even like daycare, because daycare is expensive. And but it's like the quality of the daycare, but the reality that kids really don't need daycare until they're like 4 years old. So maybe trying to keep kids at home for their own mental health, because we have this influx of like ADHD, bipolar, like all these things. And it's really just starting out in childhood of parents not having an opportunity to spend time with their kids and having to put their kids in daycare at 6 weeks so they can return back to work. So this has been something on my mind, maybe focusing more on how to keep parents with their kids as long as possible to reduce as much stress in children and mental health concerns down the line.
Yeah, and just kind of creating a profession where people can have the family structure that works best for them is something that I think we all want. We all want to be a part of a profession that supports people, parents, people who are taking care of their elders, because we all know that CHWs are caregivers. So a lot of us are doing caregiving in our personal lives in addition to our professional lives, and we want to make sure that there's balance there for our profession.
Yeah, that would be great if we could do more of that as a society.
Yes, yes. I have a question, or shall I say announcement, or just
Ooh.
Rachel, you let me know. I was wondering if, and I know I've heard a few people that have finished school, doing internship, have done, or in the middle of. We're looking for volunteers at North Point. We're actually we do school screenings for grade school, middle school, and we have a team that gets together to go out and do like dental screenings, the vision, and height and weight. And so I know a lot of times you can get your hours in if you're doing an internship, or it's someone who might just want to volunteer, and was just wondering how I could probably get this word out and for those who might be interested. And I'm just wondering, Rachel, what do you think would be good?
Yeah, I think there's a lot of need for that. There are a lot of CHW certificate students who are not currently employed as CHWs who need that internship experience. So I would love, knowing that is great, just knowing that North Point is a place to send folks if they are interested. I would also say that the Minnesota, we do have on our webpage, I believe we've got kind of like a list of potential internship sites, at least we used to. And I can try to find that. But the other option is that if you wanted to advertise like broader, we do have it. Anybody can submit content for the Minnesota Community Health Worker Alliance newsletter. And so like if there's a specific opportunity where you're like, where Peggy, you're like, oh, we're gonna need 10 interns this season, you know, flu season or screening season or whatever, you can submit something to the newsletter and that'll get to lots of folks. So I'll stick that newsletter the spot on our website where you can submit content for the newsletter is right here. I just put it in the chat. So anytime North Point or you, Peggy, want us to put something in the newsletter, you can always just click that submit newsletter content and we'll get it in if we can.
Okay, that's good to know. That's good to
And
know.
that's the same page where everybody can sign up for the newsletter. You guys are all here, so I got to think you might be on our newsletter already.
We are. Yes.
But it's a great, we do put a lot in there. That newsletter is getting busy. So we want to make sure it's got all the resources people need.
Okay, wonderful, wonderful. I'll make sure I'll check it out and make sure that I'll attach and make sure that just us here at North Point is aware of that. Because you know, we always are looking for volunteers. Like we're doing this weekend, we're doing the open streets Fit for Fun here. It's a community family based event where it's going to be open streets. It happens every year and it's open for 7-8 blocks, and it's just a lot of fun activities for the family. So we're always trying to have the family engaged and involved, even with volunteers and your family, even bringing your family out. Like we're going to be out there as employees, and we'll have our families out there with us helping and assisting and just having fun.
Yeah, that's awesome. And the other thing I'll say is that we do have monthly office hours for folks, for CHWs who want to, who need a little bit of support or want a little bit of support in career preparedness. We've got open office hours. Those were, that was in our newsletter, this past newsletter. I think it's the second Wednesday of the month. I think it's next week. It might be the second Thursday of the month, but that same page I linked in the chat, you can look at our past newsletters. So if you look at the September newsletter, and that might be so Shandy is the person who runs those, and that might be a person to just, I can let her know, Peggy, that you guys have opportunities, just so in case she hears from CHWs who want opportunities, we could just have our whole team know.
Please. Yes, yes, that would be great. I appreciate it, Rachel.
Yeah. Anything else coming up for folks? Go ahead, Angel.
I think I learned a lot just now, and I'm glad I kind of stayed and hung out a little bit to hear more information, because I just feel like when you're starting out, you just feel like you want to help and you have that fire and determination, but you just really don't know what to do with it. And it feels like things go slow, even though slow progress is still progress. You still feel like things are going slow. You want to get, you know, the internship hours, but not just that. You want to get the experience and you want to connect. So I really do appreciate the shared information that was presented.
Good. Awesome. Thank you. Put that in your survey. The long link is that survey about today. We love that feedback, and we would love to. That survey also has a space if there's topics that you want us to cover in these meetings. We want to hear about them so we can schedule them out. We've had kind of webinars in the past where we present information, where we might be moving towards having some of our webinar content be more like lunch and learns that are scheduled throughout the month. And so that this can be like more of a space for peer connection and CHW connection. But if there's specific topics you think CHWs would want to talk about, we want to hear about them. So that's in that form. I'll put it in the chat one more time. Is just the survey for today's meeting and the feedback form basically. And that's got a little space you can add topics you want to have us at future circles.
Awesome.
You
Anything
answered
else?
the question that I was gonna have. Like, I'm curious to learn like what other CHWs are doing. Just because I feel like I'm constantly looking for different things to do. So I think it'd be interesting to see like what CHWs are doing, not just in like a clinic setting, but like I know there's other organizations that hire CHWs. I work at public health and I feel like there's not a lot of public health CHWs. So then like when it comes to talking to them, like what are you doing to like be able to bill other than like home visiting? There's not like a lot of CHWs only do like home visiting. They don't do all the other stuff that other CHWs are able to do.
What county are you in, if you don't mind me asking? Are you
In
county public health?
Waseca. Yeah.
Waseca?
Yeah.
I know there are more and more CHWs in county public health. I think we had a list that was more, I had a list that was more specific to Southeast Minnesota, but one of the things that we did in 2024 was an environmental scan of the CHW profession, and I can send that summary out, but they talked to sort of all these different employers of CHWs. All right, let me just copy this link. And one of them was public health. And so there is sort of it shows you exactly like how many public health departments have CHWs. But one of the things that I think could be really helpful. So we have this, like, the CHW circle is like a statewide group of CHWs. We get together once a month. We have these conversations. It's really important. But I think what you're saying is it would be even more helpful if you had like a community of CHWs who also work in public health. So like just CHWs in Minnesota working in public health, having sort of a community of practice meeting. And I think having those spaces could be really valuable. And that's the kind of thing we would love to get in a survey, because the more we have documentation that we need things like that, the more we can justify having resources. But we certainly have connected county public health with each other. Like we've had a county public health say, hey, how do I bill for CHW services? And we say, oh, we know Dakota County does it. Like, talk to them. You know, so a lot of what we do at the Alliance is trying to connect the different groups of people that we don't maybe have all the answers, but we try to know who might have the answers to connect people.
Yeah. And it's hard too, because like sometimes certain counties have certain grants that not other counties have. And so they utilize their grants a certain way. Like one of my first duties as a CHW was I helped with the HEDA assessment. So, and like I don't know of any, like the other community health workers in my area were like, again, just doing like home visiting, or there's like a family planning CHW too. So
did you know there's an entire this is a national publication, but there's a publication that is specific. It's called Tools. What is it called? It's maybe just a paper, but it's like tools for recruiting, or for tools for recruiting and retaining CHWs in public health agencies. There's like an entire paper on it. So it's definitely something. What I'm trying to say is, like, you're not the only one who thinks we need more of this. I think there is a lot needed. And I think getting a little bit more granular in how we connect CHWs and CHW employers together could be really helpful.
Yeah.
It looks like in the CHW scan that was written in 2024, public health comes up 40 times, but obviously that's not always public health departments. Trying to find where it says how many public health agencies have CHWs in Minnesota. I don't know. They interviewed 27 public health staff for the survey, or for the scan. So basically the CHW survey and these other data and measurement work we're doing is to try to build on the work that the environmental scan in 2024 did, so that we can, like, we collected that data one time, but we want to collect it over time so we see how things change. but it's a work in progress. Now I'm just like stuck in this document trying to find public health, which I don't need to do right now. Any other thoughts coming up for folks before we close it out?
I just want to say it was really nice meeting everyone, and I'm just thankful to be a part of this webinar today, and I look forward to continuing to be a part of this group meeting. And yeah, so I'm excited, and I'm glad to be a part of this.
Yeah, next month is going to be really cool. It's going to be a presentation on the CHW platform. So we have a CHW registry at the Alliance, but we're converting it into a platform where CHWs can actually connect with each other in an online format. So we can like, it's not quite social media, but it's like moving towards social media. So it'll be a training platform and a social platform for CHWs. So there could be more opportunities to connect beyond just at these sort of facilitated webinars. So thank you guys so much for being a part of it today. I really encourage you to do all of the surveys that I sent in the chat. Please click on those before you end your day, especially the survey sort of telling you about or asking you about today. Like I said, we will be sending out a mass email to everybody on our mailing list about the CHW survey in the next few days. So you'll have a few opportunities over the month to do it, but we're hoping to get all that stuff collected during the month of September. So thanks everybody for coming, and we will see you next month.